It seems every day we get word of new cases across the country. The measles outbreak in the U.S. has grown to its highest level in 25 years, with more than 800 people infected, and experts are issuing a warning for the Chicago area. It's the largest measles outbreak since the 90s. The extremely contagious infection was eradicated in the U.S. in the year 2000, but a movement gaining momentum is leading hundreds of thousands of families to opt out of immunizing their children. The anti-vax movement has been steadily growing, and parents have a wide array of reasons to pot out. Some don't trust government agencies to approve vaccines because they're perceived to be too close to pharmaceutical companies. Others believe breastfeeding their children provides them with enough protection against disease. Perhaps the biggest myth, that vaccines cause autism. The CDC says nearly 900 people have been infected with the measles since the beginning of the year. The worst outbreaks happening in New York and Washington state. Now health officials are predicting Chicago to be ground zero for the next outbreak.
So joining us this morning to break this all down is Dr. Erik Johnson. Thanks for coming in today.
Absolutely.
He is the Medical Director of Pediatric Services for AMITA Health, and we're going to talk all about this because I can't believe that this is predicted to be in Chicago. What is it about Chicago that makes it possibly the epicenter of the next measles outbreak?
So it's definitely not predicted, but the study they were looking at was where do people fly in from countries that measles is more prevalent. And so the study was looking at different cities where we have international airports. So really our issue is we have a lot of people flying into O'Hare from other countries where measles is a lot more prevalent.
Where are the countries that you need to be worried about?
Well, on each continent, there's an outbreak going on in Europe, there's issues in Asia, there's issues in Africa, so it's really not a specific country that we have to be worried about.
Okay, is there a time that this is predicted to happen? How soon?
Definitely not predicted.
Okay,
Yeah.
all right, not predicted, but just a possibility.
Shouldn't be a panic.
Okay. Trying not to panic here. So what happens when you get the measles?
So the measles is a respiratory spread illness. So you get it from being exposed to people who are coughing and spreading germs through their mucus and through their their saliva. The symptoms, it can be high fever, watery red eyes, cough, bad runny nose, and then after a few days you develop the classic measles rash that starts from the head and kind of works its way down the body.
Oh, okay, cool. Or not cool, but something to keep in mind. What would you say to people who don't want to immunize their children?
Well, the really only way to protect yourself against the measles is to get vaccinated. So it's been a very successful vaccine. It's very safe. It's been studied more than any other vaccine in terms of its safety profile since the 90s. Mm-hmm. And so I would recommend to anybody that if they're concerned about the measles, the key is get your shots.
Get your vaccinations. Is there any risk with it at all?
So with any vaccine, you can have localized symptoms. You can have pain or swelling at the injection site. You can get some rash. You can get some fever. But in terms of will the vaccine hurt you, the answer is no.
Okay. And I know that a lot of vaccines have a little bit of the thing that you're vaccinating against. It's not going to give you the measles, right?
Right. Yeah. So it is a live vaccine that is the most effective. There was a different version in the 60s that was not as effective, mm-hmm. But you cannot contract the measles from the vaccine. Okay.
And speaking of people who were vaccinated a long time ago, I was vaccinated probably before I was in 6th grade. I remember having that be a requirement. What if you got the vaccine a long time ago? Are you still protected?
It depends. Depending on your age, some people born before 1957 don't have to worry at all. From 57 to 63, they need to be thinking about whether they got the vaccine because there was no vaccine. 63 to 67 varies. So you really just need to talk to your doctor. If you have access to your vaccine records, that's always helpful. But at the end of the day, if you're not sure, you should just get a booster dose.
Just get another one. Mm-hmm. Okay, sounds good. And then what's the ideal age, I guess, for a kid to get vaccinated?
So children typically get their first measles vaccine after the age of 1, and then they get a booster dose after the age of 4. Although you can get your second dose up to after 28 days after your first injection.
Okay, sounds good. And babies handle it pretty well. I know you're a pediatrician, so.
Yeah, the babies do great. So in my office, we give it at age 1, and they do just fine.
Okay. And how old or when should you get the vaccine?
So definitely, you should follow the recommended vaccine mm-hmm. schedule. If you're traveling or if we have more issues, we've only had 1 case of the measles so far in mm-hmm. Chicago, 8 cases in Illinois. So if there's a change in our recommendation, there'll be announcements and your pediatrician will know. but starting at age 1 would be the first dose.
Okay, better safe than sorry, guys. Get those boosters if you haven't yet. Get your kids vaccinated. Nobody wants to end up with the measles. Dr.
Right.
Eric Johnson, thank you so much for coming in and being
Absolutely.
our expert in navigating this important subject. Nobody wants to end up sick. So for more information about the measles and how to keep your family safe, head to cdc.org/measles. You can also find some resources at amitahealth.org/services/pediatrics.